Hello, you're at the third guiding principle I like to talk about. It's called less is more. Basically, this talks about less dentistry is better dentistry. And what I mean by that is prevention. Prevention is key for all healthcare. The second message I have with less is more is less complicated dentistry is better dentistry, or more complications can happen, or more post-operative problems, more long-term problems can occur when you start to add in all the tools in the toolbox all the time and you're trying to utilize them and not really looking at a long-term solution for a patient given the history of the dentistry that they brought us. So this is an interesting one. We'll end on one slide I downloaded from the web, and we'll take a look at that. So let me give you an example of less dentistry is better dentistry. It's something I talk about is the standard of care, is the 3 2s. The 3 2s means brush twice a day, floss twice a day, and see a dentist twice a year. Now, not everybody falls in that category. So let's look at the bell-shaped curve here. When you're outside of the bell-shaped curve, so let's look at this real quick. The 222, the 3 2s, is right here down the middle. So according to the standard deviations of what a bell-shaped curve really is that 68% of us will land here. And here is the 3 2s that governs the population's overall oral health. Now, here we would say these are the people, what I call the George Burnses of the world, where there's going to be a small percentage of this side of the curve that doesn't necessarily need to floss or brush. It seems that a lot of people think that they're probably in this 1X zone and they treat it as such, and then they end up typically over here because of the negligence over here. Now, then there's the really small percentage, 2.5%, possibly doesn't really have to do much at all, and they save the teeth. But it doesn't mean that they might be 2.5% of those people will never, let's say, get a cavity. But I am most certain that those people, those same people, might be in a 3X or a 4X of periodontal disease. So it doesn't mean you're out of the water. There's different bell-shaped curves. This is just the idea of the bell-shaped curve. So if this is under periodontal disease, and let's say you're in the 2X, you might be a 4X restorative problem or a 4X dry mouth patient. Those are different curves. They're not going to all be on the same curve. I try to make the assessment sheet kind of work a little bit like this, where you're kind of going from green to red, and you have the different categories of smile characteristics, bite characteristics, medical dental history. It helps you figure out how to fall into this in different ways, and why you're seeing a dentist is very important. So, like I said, periodontal disease already puts you to 3 to 4. So we know how to measure this. This is very difficult to measure. So we don't really work in this area here. We work always in this area and how to treat it. So I have 3X because periodontal disease, you might be brushing twice a day, flossing twice a day, seeing a dentist twice a day, and you still have periodontal disease. The only way you're going to really help your periodontal problem is by trying to brush 3 times a day, flossing 3 times a day, and seeing a dentist, having cleanings, routine cleanings 3 times a year. And if you're even higher than that, if you want to do better, you're going to need to go into the 4Xs, brush 4 times a day or floss 4 times a day, and see the dentist. Go every 3 months to see a hygienist or somebody to help clean your teeth. Helps those periodontal patients. That's also true for these other categories here. Now, and I didn't list everything, but I listed the top 4 that came out of my mind. Excessive restorations, recurrent decay problems, and dry mouth are the biggest things I see on a restorative level. And if you're coming in with a 3 or 4X problem, you spend money on dentistry, then you better stay in this area because your habits probably have not changed. And now new restorations are at harm if you think you can go back to the 2x level. Okay, now less complicated dentistry is better dentistry as well. And this is a very simple example. One denture's a lot easier to work with than two dentures in your mouth. Oh, that's not too bad. So more complication. One tooth removable partial denture is certainly easier to work with than this complicated piece right here, where there's multiple teeth, multiple clasps, arch bars, things going around, and they're all relying on the neighboring teeth or something to fit perfectly well to make that thing work. So here's the example of this. Now here's where, when you get into advanced general dentistry, things go a little awry, and this is very, very important. I just looked this up online for a case and found this right away. Very typical of what I see, and I talk about a case like this with dentists to illustrate the idea that more dentistry is not necessarily better dentistry. Most patients can only afford a certain amount of money to do a full arch restorative procedure. So in this case, there's already 5 implants here. I don't know what's being planned here, of course, but that would mean that there's more implants to be placed here because that becomes a very long bridge. You could do that, but they're on 2 root canal treated teeth. So I hope that these teeth are going to be extracted, but I have a feeling they're not going to be. This person's doing grafts. This person's doing multiple implants. They're doing surgical guides. You're getting very expensive here. And the problem I see with this case is that the natural teeth are left in there. Now, if you look at the reason why this person has lost these teeth or rotted away, has decay over here, has recurrent decay here, is because the habits aren't there. The 2 or 3x. This guy's a 4x on recurrent decay and massive restorations. Adding implants into the mix in this manner is a tooth by tooth solution. This is not the right solution in my mind for this person long term because they are keeping their natural teeth. He's in a ratio of 50-50. He's got 1, 2, 3, 4, 5, 6 teeth. He's going to have at least another 6 teeth on the upper with implants. That means 6 implants. So if you had 6 implants, why do you need the actual rest of those teeth? Because those teeth are going to get decay, which they already have, or they're going to fail because they're brittle and they have root canals on them. So this person is going to spend a lot of money on dentistry and then in a few years possibly lose those natural teeth. Now, on the bottom, you can also see the same thing occurring. The patient has massive decay on a tooth down here, massive decay on the tooth next door, decay on that tooth too, other decay over here. So that's possibly a lot of decay. There's possibly decay right here as well. So the problem here is the whole person is not being assessed. This should be a full arch, all on 4 or all on 6 or locator. I would prefer a 4 implant locator case is the simplest way, fastest, most effective way to not have problems today and not problems tomorrow. This case is very expensive. This is going to be a lot more money than a 4 locator or even a 6 locator over denture case. And they have still to restore the natural teeth here. Now, once you look at that, now it doesn't make sense to do that. When you look at the bottom, the same thing is there. The mouth is not tooth by tooth. The mouth is all in this oral environment, which is set up for decay. So this patient not only is going to have to spend a lot of money, but is going to definitely have to be a 4X cleanings and make sure that this thing holds all together, and there's still no guarantee. So this to me is a disaster, but this also tells me that dentists typically are not looking at it as a full complex or full system that has to work together. They're looking at it one by one. And so I invite you to take a look at something like this and evaluate that a little bit more clearly as to how much expense is going to go into this, how much time is going to go into this, and then what's the long-term diagnosis or prognosis of this situation for the patient, for especially, 3 to 4 years out. This guy's going to be spending a lot more money on dentistry, and it just spent a lot of money. So that's about it. That's our third principle. Enjoy.